Hello, and welcome to the HIV.gov's coverage on the 2024 National Ryan White Conference on HIV Care and Treatment in Washington, D.C. I'm Lieutenant Commander Tanya Grandison, one of three executive co-leads for the 2024 conference and Senior Program Management Officer with HRSA's HIV/AIDS Bureau. I'm here with Dr. Laura Cheever. Dr. Cheever is the Associate Administrator for the HRSA Resources and the HRSA Services and Resources Administration's HIV/AIDS Bureau. It's a little tongue twister there. Good thing is we call it HRSA for short. Laura Cheever is here with me today. How are you today?
I'm doing great. Thanks. I'm really excited to be here.
Great. So the conference, so it's been a while since we've been in person, since 2018 actually.
Yep.
And so we're here at the Marriott Marquis in Washington, D.C. And so who's here today? So tell us a little bit about the conference.
Yeah, well, I think the first thing to say is I'm also excited to be here in person. We did learn from the pandemic that we could reach a lot more people if we had a virtual audience. So this year we're doing a hybrid format. So very excited to be here in person, but also really excited for all the people that are able to join us and we can expand our reach. Overall, we have over 8,000 people registered to be either in person or virtually. So that's amazing.
Yeah.
The theme of the conference is innovating to end the HIV epidemic, empowering communities, expanding partnerships, and implementing interventions. And that theme really comes from what we have learned we need to do. We have the tools to end the epidemic in this country today, the HIV epidemic, but we are really going to need to lean in to empowering communities, new partnerships, and implementing interventions if we're going to get there.
Absolutely. I agree. And one of the themes today is community. So it was really great to actually have that community convened again. I want to ask you a quick question. So in the coming days, we'll be filled with the Ryan White program recipients and partners sharing their lots of lessons, tools, interventions, and ideas that can be used and adapted by their colleagues across the country.
Right.
So these have also helped to make great progress in recent years. So as you look ahead, Dr. Cheever, where is the Ryan White HIV/AIDS program headed? And what do we all need to focus on to help end the HIV epidemic across the United States?
Yeah, that's a great question. And I think in looking forward, it helps us to look back a little bit. So in the last 13 years, we've improved viral suppression, meaning someone with HIV is diagnosed, gets on their medicine, stays on their medicine, and we can't detect the virus in their body. They're not cured. But a person who has an undetectable viral load means that they cannot transmit HIV sexually and are going to live long, healthy lives with HIV,
Yes.
right? So we need to achieve that. And we've improved our rate among people in care from about 69% in 2010 to almost 90% in 2022. We did that because everyone focused on that metric, implementing new interventions, hearing from community, how do we need to do this?
Yeah.
So looking forward, where we can make the most gains is by really now focusing on people who are out of care. We take care of over 500,000 people in our program, but we estimate there are 220,000 people in this country who are diagnosed with HIV. They know they have it, and they're not in care. And so we need to get those people into care, because if we can once again work on viral suppression, they'll have long, normal lives with HIV. They won't die of HIV, which is happening today, and they won't transmit HIV to their sexual partners.
Absolutely.
So it's a win-win.
Yeah.
And so in order to do that, we really need to focus on what we have learned in the last few years in jurisdictions and communities that have been working on that.
Yeah, absolutely. This is great. This is really great. So it's great to have the partners here, but what are you most excited about and looking forward to over the next 4 days of the conference?
Yeah, so for me, it's really about the Ryan White community that we have. When people come together, there's just so much energy. People are doing incredibly hard work in their hometowns, right? There are a lot of people, they have a staff of 2 or 3 that are working with populations that are often highly stigmatized. They're working hard. They're usually not making a lot of money.
Yeah.
And they are treading lightly in any number of ways. And they come here and they learn from each other.
Yeah.
And they just feel empowered and they feel reaffirmed in who they are and the work they do. And they feel energized to move forward. So if people come here, they learn new things. They can apply these lessons learned and take it back to their community. That is what makes this conference so amazing.
Absolutely.
And that's what I'm really excited about.
Absolutely. Thank you. Thank you so much. Well, thank you, Dr. Cheever. This has been great having some time with you. And thank you for sharing sort of like a preview of the vision that you not only just see for the conference over the next 4 days, but the vision for the community just moving forward in the future. And thanks for, of course, sharing all you can, all the stats you can about the Ryan White HIV and AIDS program. Thank
Great.
you.
Thank you so much. And thanks for listening today.
Thank you.